portfolio is one of the most important portfolios in the Council, as it affects every single one of us in some shape or form, covering the areas of public health, adult social care and the workings between adult social care and health. I therefore hope we can have a meaningful discussion in the Chamber this evening on how we're going to continue to ensure Thurrock residents get the best services available within a diminishing budget, but also how we can shape the future working together with our communities with an emphasis on prevention and early intervention. I'll therefore keep my presentation brief to allow for questions and discussion on the greatest gift any of us could wish for, and that's a healthy life for ourselves and all of our residents. Our population in Thurrock is living longer, and that is good news. Unfortunately, in many cases, longer life comes with chronic health conditions and greater complexity of needs. The system that we have enjoyed for the last 40 years or so is no longer sustainable, and we must focus our attention on prevention and early intervention and building on our strengths in our communities. However, it's not all doom and gloom, and Thurrock has seen some excellent progression in delivering health and social care services whilst embracing new ways of working. In November 2013, we were the first authority to participate in a peer review. The review team were impressed with the direction of travel and commented that the work that we were doing was more wide-ranging than anything else seen anywhere else in the country. Elizabeth Gardens is now fully occupied and we have a short waiting list, and it's an excellent example of how extra care can be provided. Derry Avenue in South Ockington is another specialist housing scheme with 25 flats designed to be care ready. Completion is expected in late 2015. I'm pleased to inform the Chamber that 2013-14 was another year of good performance and progress for the department. Just to remind ourselves that Thurrock is one of the best performers in the country when it comes to preventing delayed discharge from hospital, with 90% of people discharged from hospital into reablement or rehab services still living at home 91 days later. That's not just a stat, it's a quality of life for our residents. As part of the transformation agenda of adult social care, the Care Act 2014 is the most significant change in legislation for over 40 years. It includes some positive new rights for carers and a guarantee of personal budgets for individuals, all to be welcomed. From 2016, the amount of assets held by an individual before they pay for their care costs will rise from $23,000 to $112,000. It's important to note, however, that the much talk about care cap, which also comes into effect from 2016, is just that. It is a care cap and not a board and lodging cap. Therefore, a person in residential care will continue to pay for their accommodation and food. The cap will only apply at $75,000 if they are receiving additional care. The Care Act will have financial implications for local authority. The government have told us that all costs will be covered. We wait and see if that is to be the case. The community involvement that I have mentioned earlier is beginning to show significant signs of development and community benefit. The local area coordinators that are now 7, soon to be 10, cover most areas in the borough. The first annual report is being written as we speak, but already we have seen many individuals with help from our local area coordinators going into volunteering roles or paid employment, and many more people help to access training opportunities and help with budgeting and daily tasks. With the transfer of public health to local authorities in 2013, we in Thurrock have embarked on a really positive journey in improving Thurrock's health outcomes. We know we have extremely high rates of overweight and obesity, a high rates of smoking, coupled with poor diet and lack of exercise, giving us worse than average statistics for cancer, heart disease and stroke. But once again, it's not all doom and gloom. The public health team have reviewed every contract transfer from the PCT and evaluated the outcomes from the contracts. In doing so, I believe we will start to see a downward trend in our health inequalities once the new contracts...
A vital job of being independent champions of patients, especially for patients who can't afford legal recourse against the healthcare system. In this regard, they have the opportunity not just to resolve maladministration, but to prevent maladministration. I was very pleased to hear on committee the portfolio holder say that she was still open to ideas and the budget position was still a matter of negotiation as far as she was concerned. But I was very concerned to read on page 65, under the issue of budget cuts, the £50,000 cut to Health Watch, labelled as have had to identify, as in past tense. Now, I'm hoping that's just a stylistic issue, and it's a case that this is still up for negotiation. So I know the portfolio holder has referred to her own constituents of Health Watch, as I have mine, that if we consider the issue of Basel Hospital and how long and difficult it was to help them on their improvement journey, having an independent advocate for patients is absolutely key. And in fact, I think all members should be signposting their constituents to Health Watch as the independent champions for individuals. So the portfolio holder confirmed that the issue of cuts to Health Watch and possible other ways of funding Health Watch are still up for negotiation.
Thank you, Mr Mayor. Thank you, Councillor. Can I first of all say that I value Health Watch tremendously. I use them in my day-to-day work. I found them absolutely vital, really, in the help with some of our residents. I can assure the portfolio holder, sorry, not portfolio holder, deputy leader of the opposition, that the only cuts that have been agreed are officer agreements, which are the first two items on that list, which is the 1.4 million reduction in public health contracts and the 2 million to be secured from the NHS via the Best Care Fund. The rest of the funds from the voluntary sector are still up for grabs. Of course, none of us like any of these reductions in the services that we are forced to consider. We must remind ourselves that it is the government of the day that is reducing our budget and reducing our grant, forcing us into this position. But I will give my full attention to all of the recommendations that we've had, all the consultations and the further and future consultations which are to be had.
Yeah, you list £1.4 million reduction in health contracts. We will look to get better value from some of our bigger NHS contracts. £2 million to be secured from the NHS via the Better Care Fund. And another, at the bottom, £500,000 in contracts, management savings and reduced use of agency staff. Do you not think this is probably the best thing to do, irrespective of cuts, just to try and achieve on a day-to-day, cuts irrespective, saving for residents? Perhaps in the past it might have been ploughed into this service, but now we make sure that we can come in on budget and make sure that the government of the day is not overspending its
new items to the council. For example, public health and public health funding in the past were managed, as you know, by the PCT. We now have public health in-house, so we have the opportunity to review every single contract that we hold, thus saving money. That, yes, I do agree, is essential that we do save that. But in the past, we haven't been in charge of that budget. It has been the PCT. Now that we have public health within our remits, most definitely that will go ahead and we will make those savings. The £2 million to be secured from the NHS via the Better Care Fund is a new initiative, as you know, via the Better Care Fund, and that's adult social care working with our health partners through the CCG to ensure that we secure money is saved from acute admissions to our secondary care services by enhancing the services that we're providing through our reablement team and through our rehabilitation services. So the items that you mention are new items for us to make savings to. They're not something that we could have made savings to before because they weren't in our remit. But now, of course, we're going to do that.
And consequences that we've experienced as a result of taking on public health responsibilities.
It's not just a result of taking on public health responsibilities, it's the quality of our public health team that I really think has made a difference to, and will make a difference to the outcomes for the residents of Thurrock and reduce some of our unexcusable, really, health inequalities. The public health budget, as we know, was given to us with £1.1 million shortfall in April of 2013. Myself, the Chief Executive, the leader and Head of Public Health, got Duncan Selby down, Head of Public Health England, and said that this was unacceptable. We wanted our money put back on a par so that we had our full spend for the people of Thurrock. We were fortunate enough to get that money back, and our grant this year is going to be the same amount of money with no reduction, I'm pleased to announce. So it's the quality of our team and the way that they've looked at every single contract that we hold and we held via the PCT, looking at our joint strategic needs assessment, looking at the needs of Thurrock residents in a much smaller group, rather than look at it at the whole of Essex or the whole eastern region. It's now being looked at for Thurrock residents, looking at ward by ward, breaking that down and ensuring that the money is spent in the right way to improve the health of the people of Thurrock.
Gardens as an exceptional community project, and it's worked really, really well. It's something in Thurrock that we need more of. Can you assure us that perhaps we'll work with Hanover or other housing associations to do more of these projects in the future?
Our plan for the future is indeed to be care ready and to look at the best housing for our older people as well as people of younger age group as well. So the answer to that is yes.
Well, thank you very much for your report and thanks for the rise. I know within social care generally, placement commitments could be difficult to minimize. Our placement costs affecting your budget?
Portfolio holder, the first thing that I instructed our team to do was to have a look at every placement in far more detail than perhaps we've done in the past, to ensure that we were getting best value for money but also the best possible service and care for the residents of Thurrock that are sometimes placed many, many miles outside of the borough. It's not good for themselves, it's not good for the family, and it's certainly not good for the authority. The costs of placements continue to rise, and although we've been very successful in bringing at least 9 people back into the borough, relocate them in at a saving of £175,000. If I give you an example, we have one placement transferring over from children's care to adult social care that will cost us in the region of £600,000 per annum. So you can see that the pressure for placements is one that we are continually working to, but it's not easy, is the answer. Thank you.